Thank you, Connie, for joining me this morning. Hopefully the brokers got on, and I want to welcome the brokers. Good morning for another interview of IAD and our wonderful carriers throughout Michigan and throughout our country. So today we have Connie from Priority. My name is Yvonne Blanco. I am a broker sales manager here at Insurance Advisors Direct. I specialize in the D-SNP market, but also help with all the other carriers and all the other product lines. So I wanted to kind of just set up something a little where, you know, there's such a disconnect right now, Connie, that I wanted to be able for us to have a nice discussion, maybe address some of the questions that a lot of the brokers, I think, are doing self-taught. They psych themselves out on how they cannot help people in this market. And so we're just going to address some of the challenges, maybe some of the pitfalls, or just some of the, you know, ideas that brokers have that this could be very difficult to do, so then they just don't. So, and also, I think that anybody that has a book of business, someone in their 360 is going to have Medicare, Medicaid. And wouldn't it be nice if they could help, you know, grow their book in that fashion? So, if you want to go ahead and introduce yourself, I don't know if some of the brokers know you and stuff.
Hi guys, I am Connie Elkins from Priority Health. I am the Southeast Michigan Regional Sales Manager. There are 4 of us. So if some of you are tuned in from other areas of Michigan, Monica Short, Ladam, Brandon, or Jim Hart may be your representative. We all represent Priority and we help each other out. So feel free to call any of us if you need help.
Great. And we're going to put your contact, you know, at the end of our interview, and I'll have my contact. And so right now we won't be, you know, answering, you know, we're not taking questions from the audience, you know, but we do accept those questions. And then later on, we'll reach out and make sure we can go ahead and answer those. We'll have like job aids and stuff like that, of course. So with that, I have a couple of questions. I think one of them was that we had discussed was, you know, what do you or how do you suggest the agents handle this MMP auto assignment for the members? And then we'll go into as far as like fact finding. What are those steps that you suggest an agent take for those fact findings when they do that?
Okay. So for those of you that know, the MMP is actually, we're on the southeast side. So in my territory, we're talking about Wayne and Macomb County. Those are where they call it also the demonstration model. Yeah. And that is where, if you have someone that's Medicare and Medicaid, the state auto enrolls them in one of the carriers that is in that MMP program. The carriers that are in the MMP program are going to do some things. They're going to offer some benefits that maybe the standard D-SNP plan does not. Right. I want to preface this with Priority is not in that MMP. We are not an auto assign. Right. So what does that mean to you guys? What that means is you decide after you've done your fact finding that Priority Health is the best carrier for your member. And you put them with Priority Health as of April 1. And you get a call from your client on April 3rd and they say, hey, I just got a name of another insurance company card. And you're thinking, how did this happen? It is because of that auto enrollment. So if you've decided and you've talked it over with your client, so have we decided? Because the MMP, you know, does give them some of those home health aids, some of the things
that's very important. Yes.
That are not standard. What Priority offers is, you know, that large network of doctors. So every doctor that is in our standard Medicare Advantage plan. So if your client needs or wants to go to U of M, they need or want to go to Henry Ford, Carmano's Cancer Center, we see all of these things, then maybe, and or the drugs on the formulary. Because again, we don't use the Medicaid limited formulary. It's the same formulary we use on all of our Medicare Advantage plans. So if those things are the reason why your clients can be better served, and we're going to get into case management, and that is one of the things pride themselves on. But if you decided that those are the reasons, then you're going to need to work with your client, and you're going to need to have them actually, they're going to call Michigan enrolls, and they're going to disenroll from that auto assignment. And you may ask them to actually disenroll for all future. So they're going to disenroll, and you would use a unique term for that.
Well, and actually, we do have a script. I actually got a script from Michigan Links and Michigan Bridges. So, it's about 3 pages, and I condensed it to the important paragraph. The phone numbers, there's 2 different phone numbers you can call to do that. So I provide that to our brokers. So we'll have, basically break that down. This is the number, this is the script, and there is, to disenroll and to opt out. And we provide that for our brokers. Make it easy, right?
Yeah, well, and that's one of the things is this is a complex. So it's not that hard, guys, but it's a little complex. And so when you're working with somebody like IAD and they give you all of the tools and tips, they're going to make it easy. And so all of a sudden you're going to wonder, why was I afraid of this market?
Right, exactly.
And that's what we're trying to do. So once you've done your fact finding, that's what the MMP is.
Right.
On the west side, there's a lot more counties. So if any of you, and Yvonne has that list, she and I were talking about that. So we can, and I'm sure she already has, she is so on top of it, guys, that I'm sure she has all those counties ready for you. So if you're wondering, I live here on the east side, but I got this lead over in Grand Rapids area. How does that work? She'll be able to provide you those counties, because it's not just, there's a lot more over on the west side of the state. So it's not just Macomb and Wayne.
Right, exactly. I appreciate that, because there is, I think, a misconception that it was only on this side, on the east side of the state, and there are more counties on the west side. So, being aware, right, to what counties those are, and then be kind of preventative on catching that when you're having those members. Well, great. And I do want to say on that fact finding, you had touched a point where some of these members are getting, a different kind of care, where they have that home health care. So that is something to keep in mind for the brokers. If they do have that home health care through the MMP, really find out what does that entail, because like,
and are they using it?
Exactly.
That's the thing is, are they using it? When you do your interview and your fact finding and finding out, and please know they'll sometimes forget to tell you a doctor. So you're going to, Yvonne has this really cool thing is any doctor that touches your body.
Right. Any doctor, any physician that touches your body, they need to know, because when they ask if it's just your primary care, then they forget to tell you the specialist, or maybe the podiatrist or dietitianist, or whatever, whoever they're seeing.
It can even be the acupuncturist, because we have acupuncture as a covered benefit.
I love that. Yes.
So there's all kinds of cool things that you need to know, and we'll get into it a little bit more, but if you start off with them saying, I'm willing to switch doctors, I don't care who I'm with, I just need dentures, then guys, that's your go-to card.
Right.
I would put that in your notes, because when they call you 6 weeks from now and they have a complaint because this isn't covered, that's not covered, that you have your notation that says, I only want dentures, or I'm looking for whatever that is, the highest OTC. And that's why you chose your carrier.
Right.
Know that you've got that in your notes, because that's going to help you if you end up with a compliance issue.
And that's part of that fact finding. Love that. That's a great tip. Thank you. Okay, so now, as we know, the treatment of our DSNP community is usually underserved, quickly set aside, maybe looked as troublesome, switching a lot. So how does Priority change this up with their model of care treatment of their members?
Okay, so our model of care treatment, and in order to prep for this, guys, I kind of I did a little bit of fact finding. So I interviewed our case managers, and I have to tell you, I was so excited because they were so enthralled with their job and how they do this and what they do different. They were like talking over each other, and
they have a passion about what they do.
They have a strong passion. So that is one of the things that some of them have worked for other carriers, and they're like, this is what we do differently. Our ratio for care management, and that's a whole team. So, you've got your nurse, you've got your caseworkers, you've got your nurses aides, you've got all of those. And then based on the members' need is what they have to determine in that model of care is how often do you need to be touched?
Right.
Which brings us to the, how do we know how often they need to be touched? And that's that health risk assessment.
Oh, yes. Yes.
So when you
go into that.
Yeah. So when you submit an application, what happens first is we send out that welcome kit. And that's
right.
And this is what, guys, I know that you're going to say to me, Connie, I have until March 31st to get an April 1st effective date. If you've got a high risk client, that is probably not in their best interest. And here's the reason is we're not going to be able to reach out to them with the welcome kit. It's going to take a couple days before we've submitted it to CMS and we have validation. So now here it is. You've submitted the application on 3/31. 4/1, their coverage goes into effect. 4/2, they want to see a doctor, they want scripts, they want all of that sort of thing, and they're not even processed in the system yet. So let's use the example that you put them in March 15th.
Right.
So we're going to send them a welcome kit, and in that welcome kit is going to be their member ID card, and it is going to be a health risk assessment with a pre-addressed stamped envelope. So this is where we need your help in order to give your client the very best service. Because that health risk, if they're on oxygen, if they are using a hospital bed, if they are getting, let's say, and I had one of the examples yesterday was the 450-pound man that cannot leave his house.
Wow.
So he needs to have doctors come to him, that sort of thing. He has breathing treatments. He has all of this done in his house. If we get that 4/1, that we just are opening that up, and he's supposed to have a breathing treatment, he's supposed to have whatever on 4/2, it's not going to happen. So we want to make sure that we get that health risk assessment. So coach them in filling out this health risk assessment before, because we can send them the kit, we can send them the welcome kit, we can send them their ID card, but we cannot reach out to them until they're our client on, let's say, April 1st.
Right. And I see how the health risk assessment kind of is, works together hand in hand in order for you to do that model of care. That priority is really made a strong base upon, right?
Right.
So if the agents are not maybe just making aware to their members, hey, you're going to get this separate envelope when you get it, and they can
it's actually in their welcome kit.
That's in their welcome kit, right? So, but a lot of people
remind them to open it, because
I was going to say a lot of people just put that, they get their card out and then they just put that envelope away, right?
And hopefully they get their card out, because a lot of times, and I'm hoping your agents, when they go and they see these people at their homes, you'll see stacks of mail. The people get their mail and they put their, it could even be, their education level could be such that they're waiting for someone to help read it, explain it to them, because let's be honest, insurance is confusing anyway.
Right.
And if these people don't have a higher education level, or maybe English isn't their first language,
or they don't have glasses, to be able to see that.
Yep, there's a whole lot of reasons. So just tell them, if you're prepping them, this is the best thing for you to make your client happy and for them to get the best service possible. So if they don't fill out, so let's say they don't fill out that health risk assessment, within the first week that we have them, we have a case management team reaching out to try and complete that health risk assessment on the phone. So that's the other thing that you guys can do, is tell them is, the carrier is going to be contacting you, because they get all those spam calls and all that sort of thing. So they're a little apprehensive when they get a call, especially someone asking, your doctors, your meds, your all that sort of thing. They're a little bit leery, and they should be, because
they should be,
maybe they have been taken advantage of. So really help coach them in that health risk assessment. So in the first week, if we haven't been able to reach them by phone, we're sending them a letter, which again, we know that they don't always read their mail. In the first 2 weeks, they're going to get 3 phone calls. If we haven't been able to get them, they're going to get 3 phone calls and 3 letters.
Right.
At the end of that second week, we are sending out one of our community health partners. to actually go out, knock on the door, try and make contact with this person, because for one, when you're talking about DSNP and the model of care and our STARS rating, we have to, in that first 30 days, get that model of care going, because these are people who have health risks. They're Medicare or Medicaid. You'll have some that are just Medicare, Medicaid, and not
there's right as rain. Right.
Not have a lot of health risks, but you're going to have that other side where, because they have been Medicaid and low income, they maybe haven't been able to take care of themselves. Maybe they are not living in a great environment. The other thing that health risk assessment lets us know is, are they vulnerable in other areas? Do they have food? That was one of the things my case managers were so emphatic about, is we need to make sure, do they have food? Are they safe? In the housing that they're in, are they safe? Do they have proper housing? Do they have heat? Do they have running water? All of those sort of things. That's what the case manager, because how can you stay healthy if you don't have food, proper shelter, if you're worried about being harmed? So those are things that they take very, very seriously.
Well, and this kind of comes into, this next question that I was going to ask you is, a lot of brokers, they might take care of some customer service questions, but, you're touching on a point where priority, and the question I had was, what can priority bring an agent, when they're writing their members on that plan? And you've just answered that, but I think what's important is the division, right? Where some of the brokers might feel, oh, I don't want to be someone's case manager, right? Where you're saying priority, if you just help us get this information, maybe even just let the member know that they're going to get someone calling them. They're going to have that visit from your risk assessment, team. And maybe even just help them with that form if they can't read it or whatever, read it for them, something of that nature. And we're helping this community or this population, I think, pay attention to one of the most important things, which is our health.
Yep.
Right. So I really appreciate that you're brightening my eyes, in the sense that I didn't know that HRA form really work together.
Starts the ball rolling.
Yeah.
So then what happens is, all of our clients have a case manager assigned to them. That's not the case with our regular MAPD. So I'll sometimes have people that'll say, hey, I've got a DSNP. And they prefer, Connie, to write your EDGE plan so that they can go to any doctor. Guys, that's with priority. We're a little bit different. While our DSNP is an HMO, our members still can self-refer. So if they need to see a doctor at U of M or wherever, as long as that doctor is in our network, the member is free to go. They will have to show both cards. They're going to show their priority health card, and they're going to show their Medicaid card. If the doctor accepts them as a patient, there is no balance billing. There's none of that. And they are not supposed to be turned away. Although I say they're not supposed to be turned away, guys. I am not a DSNP person, but I was looking for a new primary care, and I was turned down because I was not going to come in every 3 months, that sort of thing. So remember, all doctors have the right to refuse patients, and it's not always an income thing. It's a compliance.
Or they just maxed out on how many patients they can see. Right. There's a lot of factors.
But when you're talking about doing customer service, which is one of the things that you were talking about, one of the things that all of our DSNP members are going to get is the phone number to their care management team. So the first person that answers that phone is not necessarily their nurse. It might be that CNA, that certified nursing assistant. It might actually even just be one of the clerks. And they're going to talk to that member, and they're going to find out, what is the problem? Is it just that you need another script? They're going to take care of that. But if the person is having problems and they're like, I don't know if I should go to the doctor, I don't know, that's where the case manager is going. That's where it's going to get elevated immediately to the right person in their care management team. Interdisciplinary team.
Yes.
And so they're going to get directed to that person. So we make that first health risk assessment. And at the end of 30 days, we decide, what level are they at? So maybe they're at a medium contact point. So that means every 2 months, they're going to be contacted.
Right.
Maybe every 3 months, based on their drugs, based on their issues. But it could change. So they get that phone call and now they're having a tough time. So now maybe they're going to get a call every 2 weeks. If they're on a particular drug that's a high risk drug, and or life sustaining drug,
Right.
there's actually a timer that is set so that they're supposed to fill that drug, let's say every 30 days, because this is not a 90-day drug. This is a high risk drug.
Yes.
On day 33, there's a timer that goes off and it says, Mrs. Jones didn't fill her XYZ drug. Someone from our case management team is going to call her, say, hey, Mrs. Jones, is everything okay? He may say, I've got the flu, I can't get out and fill it. We're going to have that drug delivered to her. She may say, I went to the doctor last week and I got a 2-week sample. We're going to reset that timer. So
right.
That's how so when you talk about managed care, guys, I know it's got a negative connotation, but when you're talking about a vulnerable population, it's not a bad thing. This care management is to make sure that they're staying as healthy as possible and, taking their meds. Maybe not taking their meds means their heart's going to stop. I mean, those are the things we need to watch.
And, I think that it's important to know, because some of the brokers might, do that. Like I said, psych themselves out, that self-talk of, I don't want to deal with this, being their caseworker kind of mentality, or maybe take on too much of this customer service, right? So it's good to know that each of them have this care management team, and that you guys
that
are
phone number
with them. Right.
Yep.
Exactly. Well, and I think you've touched on how, what they expect those first 3 weeks. You kind of ran us through those first 3 weeks to a month of how Priority takes care of that member. But are there any expectations, we'll say, or maybe suggestions from Priority on what steps the agent takes during those first 3 months, maybe to a year, with that member on the plan?
Yep. So we talked about the welcome kit that comes from Priority Health, but remember, we have a ton of vendors. And the biggie that a lot of our DSNP clients are looking for is over the counter. Now, our over the counter benefit isn't as high as others, but it's a great opportunity because they can order online, and most of them don't have online, but they can look at the catalog and they can basically shop like the old Sears catalog. Okay, I want this one. I call the 800 number. It's delivered in 2 days. So they can shop online. They can shop by the telephone, or they can go into the brick and mortar stores and they can present that debit card that they get, which is recharged every 3 months. Now, again, that problem with the mail is you guys need to tell them, this is a big thing, whether you're talking about our regular MAPD plans or our DSNP plans, is let them know they're going to be getting an 8.5 by 11, pretty much plain envelope. And it says Solutran, that's our vendor for our OTC. And it says important plan information. And your client picks that up and says, I don't even know who Solutran is. And they throw it away. That's where you come in and say to them, you're going to be getting another envelope. It's a plain white envelope. It's from Solutran. It's going to have your OTC booklet, your whole catalog, and it's going to have your debit card. And when you get your debit card, you have to activate it just like any other debit card and keep that safe. So that's where you guys are going to help us, because if you do your follow-up, which Yvonne was alluding to, is, really at the end of 30 days, you need to call them and say, because this actually stops them from calling you with compliance issues of, I thought they said I was going to get an OTC catalog and I never did, and they lied to me, and it has nothing to do with that. The catalog that's on their kitchen table and they haven't opened it. They weren't aware of it. In that stack. So,
well, and I think that what you were saying is, just how the brokers might not have, because the Solutran, I don't think, there maybe some brokers are. I know that I've told a few to let them know to look for it, as well as, to look for any kind of letters from the actual Michigan bridges as well. Those first 3 months, I think, are real vital on how the rapport and that connection from broker to their member.
Yep.
You know, it's going to be this back and forth. And I think I've seen a lot of, especially in the D-SNP market, where a broker will write them and then there's no touchback. Or maybe there's a touchback, you know, 6 months later.
And they may already be gone, because what happens
Right.
is they were waiting for that over-the-counter card.
Right.
And they think they didn't get it. If you're calling them back within that first 30 days, you can head that off. Maybe they didn't open their mail and they say, I never got my ID card. You can call our broker line and you can actually have that ID card sent out. The member will have it within 7 days. Maybe they threw away. So when you talk to them about that OTC, they're going to say,
Right.
oh, I got that envelope. I didn't know what it was. I threw it away. Let's
Right.
order them another one. We want to make sure that they're getting the benefits that they need, rather than leaving you as the agent
Right.
and Priority Health, because it costs us over $250 in that first 2 weeks for every new member you put on. And the D-SNP is higher than that, because it's usually we issue a third more ID cards. We
Right.
issue
Wow.
a third more to a half to 50% more OTC. They'll lose their card, that sort of thing. But guys, that doesn't mean we don't take care of them. That means we
Right.
really need to touch base with them, because that keeps them happy. Man, you're going to be the best agent they've ever had. When you tell them what to expect from us, they're going to be so happy with us too. So it's that expectations. Let's set those properly.
Well, and I like, you know, as far as brokers, you know, reaching out, like we said, that first 3
30
months,
days. Yep,
you
the
know,
first
30
30 days.
days, 30, 60, 90, right?
Yep.
And then after that, you know, we were talking about just agents doing that follow-up, that touchback. You know, a lot of,
And
and
if
it
I can
kind
say
of,
one thing,
yeah,
make sure prior to AEP, because remember, your D-SNP clients are like people who have just low income subsidy. So they get to make one change every quarter, the first 3 quarters, and then once during AEP. They're going to be
right,
getting all that
yeah,
mail too, and they don't know the difference, because something looks, you know, really flashy, and they're like, oh, I'm going to go with that, not realizing that by making that move, they're losing that doctor that you assured them was going to be in this one network.
right, right. And I think also I wanted to point out, you know, we also help not just with the job aids, you know, areas, what networks are there, breaking it down for the brokers, but also help with these LIS. You know, I call it the sweet spot right there, where, you know, they're maybe a $4 over to even qualify on Medicaid. We've seen that, right?
Yes.
But there are programs, there are different avenues to help those individuals too. And like you said, they also fall into an SEP.
Yep.
So they can make that quarterly change. Well, great. And so I think the last couple of questions I had was, you know, most of the D-SNP population won't have, we'll say, internet or maybe a computer access to a scanner or any of this stuff. So what are the workarounds that you're seeing that work smoothly with the agents to be able to still sign up the D-SNP community?
Yeah. So for one, guys, you know, they may or may not be comfortable with meeting you in person.
Right.
So remember, you still need that scope of appointment. Are you going to mail it to them, expect them to fill it out, mail it back, all that sort of thing? We actually have a telephonic scope of appointment. So when you're talking to them and they're like, yep, I want to hear all about it, you can, so you're going to have them on the phone and you're going to call the priority 1-800 number. I don't think I didn't provide this to Yvonne yet, but I promise
I have it though. But I have it.
Yep. So we have that 800 number, and then with the two of you on the phone, they're going to take your client's name, their address, and their date of birth, and they're going to ask them, you know, you want to see and we'll go over all of those things on a standard scope of appointment. Even though we don't sell standalone PDPs, we don't sell the ancillary. And remember, you have to be really careful with the D-SNP, because you can't sell them the standalone dental and that sort of thing. Medicaid has to pay for it. You can't charge them because they are low income.
Right.
But they're going to go over that standard scope of appointment. Then they're going to give you a confirmation number. Write that confirmation number down. They're going to disconnect. Now it's you talking to that client, whether it's at that particular time or you set up another time. You're going to talk about all the plan benefits, that sort of thing. Then they say, yep, I want to go with the priority DSNP plan. You can actually take that, like as you're talking to them, the paper application, whatever, but you have to make that one final call to the same 800 number. And you're going to do the acknowledgement form. So they're going to say their name, their address, their date of birth again. And then they're going to acknowledge, yes, I want to sign up for the Priority Health DSNP plan effective 4/1. And they're going to read them the disclaimer that says, and this is what keeps you guys compliant. This is the same as a wet signature. So our regional compliance officer said, this is as good as a wet signature. And because the people aren't just signing without reading, when they hear, I agree that I am signing up for this plan, you don't get those compliance issues where they say, I didn't know I was signing up. I didn't agree to sign up for a plan. I thought I was just getting OTC. I thought I was just getting dental. So that's what that acknowledgement form is. Again, they're going to give you that confirmation number. It'll be the same as the first one if you've done the scope of appointment. So that allows you to actually talk to these members via the phone without meeting with them, without having to use a computer they don't have to respond with a computer.
Right.
And then
I think there's other,
excuse me, you're going to go
online. Go ahead.
Just like you normally do, and enroll that application with us. So 2 separate ways. Keep that confirmation number, just write it on your application so that if they do say something and we need to have that scope of appointment, we're just going to pull up that recorded scope for you.
Okay, so and that's kept in your guys' database. It's not where the agent has to download it and save it in a cloud or any of this.
Nope.
Okay, good. I've explained that where once you do that with the carrier now houses that for you. So I do like that the telephonic enroll or the scope of appointment. We'd also have general scope of appointments for the brokers as well.
And that may be the sort of thing, you have a DocuSign or you want to use that. Priority does not require that you use this. So if you've got another way to telephonically do it, that you're doing this, we'll accept all scopes. So we're not carrier specific on our scopes. But that virtual acknowledgement, guys, there's a lot of carriers that are not doing this. And our regional compliance officer, this is Connie as the previous agent stepping in. I created this form and our regional compliance officer is just excited. He's like, every carrier should do this because a scope of appointment only says you've agreed to talk to them. So if there's a problem down the line, there's no proof that they said, yes, I wanted that DSNP, I wanted that. And you do have some compliance issues. So he is thrilled to death. I should be a little upset. He suggested this to another carrier who's got some problems.
Oh, well, and I think that as we, go into these communities and we're serving, individuals that, they're not, how can I say, maybe they're just not being explained these benefits, because they're just shown the shiny thing, right? And they're not really explained, how this stuff can benefit and give them that quality of life that a lot of people might have just said, oh, well, I'm just waiting here. What's the use of just existing? But when you have the priority team that helps you, and then even a broker that might send them, 1 or 2 cards a year, it makes a difference. It really does. Well, and so, with that, I just wanted to, again, thank you for taking the time.
You answered some about Priority Health, and hopefully you felt, because having talked to our case managers and feeling their enthusiasm, I got more charged up about, one more product. I mean, I think that's when you work for a carrier, it's like one more product.
One more product, right.
So, but, we have just, so, and I'll be quite frank, because everybody needs to know, and you need to decide what's the best carrier plan for your client. So if someone wants, so where's Priority not this year? We are not the highest on dental. There's other carriers that are better than that. We're not the highest on OTC. From talking to our case managers who've worked for other carriers, they're saying that's where we've put our money. That's where we're really growing, is that case management.
Yes.
But 2022, we're going to put a few more bells and whistles, but it's our network, it's our formulary, it's our care.
I love that. Well, thank you so much, Connie.
Thank you for having me.
I want to go ahead and share our screen with our contact information, so we can go ahead and have people be able to contact us. And let me see if I can get that back up here. I want to be able to put our full screen of our stuff. There we go.
Cool.
So that way, if we have additional comments, questions, like I said, we do a lot of trainings. A lot of the brokers are looking at spreadsheets, seeing the benefits, seeing the summary of benefits and everything that the carriers, as far as our trainings, that they're pretty boxed on how it flows. And I think there were some important points that some of the brokers, have asked me. I'm sure you've come across, and just wanted to address those and have a little, visit so people don't forget us and that we're here doing our fact finding, our resources. And of course, they can reach out to your emails here, my email, and our cell phones, and how they can reach us.
Yep. And I will be sending those additional resources, which I know you'll share with your agents.
Yes.
So I'm happy to do that.
Well, thank you so much, Connie. It was so good to see you. And I look forward to visiting with you again. Thank you, everyone, for joining. And have a great
afternoon. And
have a great afternoon. All right. Well, you have a good one. Thanks so much, Connie.
Bye.